every other hospital as well, and we're thankful for that. The one thing I do want to say to Scott's question is this. Many of the facilities that we're looking at to expand capabilities, expand capacity in Mississippi, keep in mind that we're not just looking at, for instance, opening the trademark and make it an ICU wing. What's more likely is that we would be willing and able to open up additional facilities that would be more of a transition unit, for instance. So if it were just COVID-19 patients, perhaps you go into the hospital, you are in the ICU, you are on the ventilator, 3 or 4 days later, you are doing much better, you are recovering, and no longer need that intensive care provided. So maybe we would have a facility where you could transition so that it would open up that room and that ventilator for someone else. And so, I don't want to call it a swing bed, but in my simple mind, I think through it as a transition bed, a swing bed that helps transition someone back into society. The other possibility for these potential facilities is, we have folks that perhaps are homeless that may contract COVID-19. And so if in fact they are in the hospital and they recover but have nowhere else to go, and we certainly don't want, and they could potentially, I guess, still be a carrier, we don't want them going back with nowhere to go. So it's people like that. So it's lots of different opportunities. The other possibility is there are going to be a number of people that contract the virus, and we see them already, that are going to need or require hospitalization, but they're not so bad that they're going to need to be in the intensive care unit. Perhaps they would be a possibility for these units. So I don't anticipate, unless we see a worst case scenario and we are asking the federal government to come in and help us, which is what's happened in New Orleans. As you know, the federal government's trying to put 500 new beds in the city of New Orleans, but we're monitoring that. We're supportive of that, by the way. I've told the president not once but twice that I support Governor Edwards' request for federal help in the city of New Orleans, because we know that we are so close, and we also know that so many of our residents are transient. We have a lot of Mississippians who work in New Orleans. We have a lot of Mississippians who, hopefully not now, have played in New Orleans. And we have a lot of Louisiana residents that work at some of our critical industries like NASA, the Stennis Space Center, like Ingalls, etc. So, yes.
In your executive order last week, department stores are not considered essential. However, they are exempted from the 10-person gathering rule. Based on that executive order, we've received reports from employees saying that some very non-essential department stores, some very large department stores, are actively planning to open their doors possibly sometime this week. Do you have any response to that? And based on what that order was, is there any way to stop them, or do you have any interest in stopping them?
Well, I have not had reports of any large businesses opening up. What I would tell you is if those entities are not essential, then it's critically important that we stay closed, that we adhere to the social distancing guidelines. It's incredibly important that we don't allow more than groups of 10 or more. Now again, a group of 10 or more in a room of 50,000 square feet where you're not within 100 feet of one another is different, of course, than being in a room this tight. But it's very important that not occur, and that we all act in good faith to protect ourselves and to protect one another.
But are you looking forward to any additional enforcement to prevent something like that from happening?
Well, I will tell you, I've talked to a number of mayors just in the last several days that are, in fact, making sure that in their communities that doesn't happen, and we're looking at it further as well.
You talked about those who live or work in Louisiana coming back and forth. I know that MDOT put out some information yesterday, but just want to hear from you regarding whether or not there would be any consideration for any kind of checkpoints or anything along those lines, especially given the number of cases in, say, Louisiana and even in Mississippi.
Yeah, we've had those conversations. We've talked with some local officials about those conversations. I will tell you that we are not at a point right now where we are issuing any sort of checkpoints, et cetera. But I will tell you, if you, we expect our neighbors in Louisiana who travel to Mississippi to adhere to our rules and our regulations and to our recommendations as well. If you're from Louisiana, you come to Mississippi, you need to stay at home. You need to make sure that you are practicing social distancing, that you are not gathering in groups of 10 or more, that you are, if you're going to work, that you're going to essential businesses where it is okay for you to, under the order, to comply. But we are taking nothing off the table at this point. We are monitoring it, and we are trying to make sure that folks are adhering to the guidelines that are in place.
Dr. Byers.
Yeah, sure.
Yeah, I do want to ask about beaches. Are there any other ideas about closing beaches or other tourist places like the reservoir in the state?
We have certainly had conversations about that. I will tell you that in the executive order that we issued for Lauderdale County today, we did close some areas. They're not beaches because we don't have beaches in Lauderdale County, but we are closing some areas that we think are important things, all places of amusement and recreation, whether indoors or outdoors, including but not limited to amusement parks, rides, museums, playgrounds, children's party and play facilities, parks, not to include walking trails, movie theaters, bowling alleys, and social clubs shall be closed in Lauderdale County. And so as we continue to watch the data, and the data record suggests that we issue similar orders in other jurisdictions, I would imagine that if we get down to the coast, then that would likely be the case. I will tell you that some of the local jurisdictions have in fact done that, shut down certain areas of the beaches, certain activities on beaches, and we are ready and able and willing to provide state law enforcement to help monitor that should the local authorities ask us to. You have follow up?
Yeah, one more. And when it comes to schools, you know, the president's extended his recommendations for keeping things closed. Are we going to be looking at extending school closures until the 30th?
That will be under consideration. To be perfectly honest with you, he extended his order yesterday. Our schools are closed until, in effect, April the 20th, because the order goes until April 17th, which is a Friday afternoon. We'll look at that at the appropriate time. We've got a little bit of time, so it hasn't reached the top of my agenda to review at this time. But it is not off the table. Let me just say that. Scott?
Getting back to the nursing home, I'm curious, Dr. Byers, why not release the name of the nursing home? That's not a privacy issue. I would think that's a public health awareness issue. Why not release that? Are you worried about creating a panic?
No, I'm not worried about creating a panic. The individuals who are at risk for infection from that nursing home have been identified, and we've worked with them. It's not a larger issue outside of that nursing home. And so what we're doing is being sensitive to those residents and their privacy. And we're working very closely with that nursing home.
So people who interacted with that place, would they be notified too?
If we identify an individual who is at risk from contact, absolutely we notify those individuals.
Dr. Byers, will MSDH be releasing any racial demographic data about COVID-19? And who it's
We will, and we've started looking at that now.
Do you have a
And we
timeline for that?
You know, we're working on a number of pieces of data that we want to look at closely to verify and confirm. So as we move through, you know, this outbreak, we will be releasing more data. We'll be releasing additional data that provides clarity on who's being impacted. So, you know, we're looking at all of the data right now. Thank you.
Just as a reminder,
Last question.
yeah, and just as a reminder, Scott, last week in the executive order, one of the statewide restrictions that we made is no visiting hospitals, no visiting nursing homes, no visiting any long-term health care facilities. And so while some of these cases probably were initiated before that was in place a week or so ago, at least for the last week, they should have not had any visitors that were not employees that were safe.
Yeah, so the mayor of Tupelo, Jason Shelton, just tweeted during this press conference saying that folks in Lauderdale County are just going to go outside the county to do like their shopping or to go visit businesses. And he called the approach, he said it's a hodgepodge approach. He called it baffling. How do you prevent folks from leaving Lauderdale County to doing those kind of non-essential things that could then spread coronavirus?
Well, I will tell you, I think that the vast majority of Lauderdale County residents are going to comply with the order. I am confident that Mississippians are smart enough, are patriotic enough, are paying attention to what we are saying. I will tell you that I actually went to my office yesterday and stood on the 19th floor of the Sillers building and looked out over the city of Jackson. And while there were obviously automobiles moving from point A to point B, I couldn't find one individual out walking the streets. Now look, there is exceptions to that, but one individual who is walking down the sidewalk all by themselves is not at a significant risk of either contracting the virus or giving it to anyone. And so, look, there are those who believe that government ought to take over and run everything. There are those of us who are going to take a data-driven approach. That's what my experts, Dr. Dobbs and Dr. Byers, are recommending and suggesting, and we are going to continue to monitor that. But I do not believe that we're going to see a large number of people in Lauderdale County run up to Kemper County to go shopping.
So how do you prevent them from not leaving Lauderdale County? Even if it's one person, I mean, it's an infectious disease. Virus.
Well, our ability to monitor this is an ability to utilize local law enforcement, to utilize the county SOs, to utilize the city police, to utilize the state highway patrol, potentially utilize MDOT law enforcement, potentially utilize wildlife fisheries and parks law enforcement officers. So it's going to be a joint collaborative effort to make that happen. So thank y'all very much for being here. I've got another call. So thank you very much. Again, I want to just reiterate, this is the first order of what may be several more coming as the data suggests it and as the data requires it. And again, I want to highlight the mere fact that these two gentlemen behind me and their teams at the Department of Health and the Emergency Management Agency are working day and night to protect Mississippians, and I'm personally thankful for their efforts. Thank y'all.